You know, when you watch a movie or like scroll through social media, a positive pregnancy test is always portrayed as this grand finale.
Oh, absolutely. The music swells, everyone cries.
Right. The couple cries happy tears, and the screen just fades to black. Culturally, we really treat that two-line stick like it's the absolute finish line of a long, exhausting race.
We are entirely conditioned to see it as the definitive happy ending. I mean, the hard part is over, right? Now you just buy a crib and wait 9 months.
But the reality, especially for you, if you've had a really difficult road getting there, whether that involves, years of unexplained infertility, multiple rounds of IVF, IUI cycles, or just the profound heartbreak of prior loss, it is entirely different.
Completely different.
That positive test isn't the finish line at all. It is literally the starting line of a completely new marathon, and it requires a totally different strategy to run it.
Welcome to the deep dive. Today we are looking at the vulnerable, highly complex, and honestly often anxiety-inducing first few weeks of early pregnancy. It's such a critical phase, and it is almost universally misunderstood. We are pulling today's insights from a highly specialized source, an expert guide titled How to Support Early Pregnancy with Purpose.
And that's provided by the Berkeley Center for Reproductive Wellness.
Exactly, yes.
Yeah.
The Berkeley Center for Reproductive Wellness.
Awesome. So, the mission for our deep dive today is to really cut through the overwhelming, frankly deafening noise of internet promises and social media advice.
Because there's so much of it out there.
So much. We are going to extract a clinically sound, practical, and emotionally honest roadmap for those first vital weeks. Okay, let's unpack this. Because to run this new marathon, the very first thing you need to figure out is who is actually handing you the water cups along the route.
That is a great way to look at it.
Right. I mean, before you spend a single second worrying about what organic vegetables to eat or like what vaginal prenatal supplement to buy, you have to establish exactly who is on your care team and how they communicate with each other.
Breaking down those silos of medical care is step one. Because the reality of modern reproductive medicine is that early pregnancy care just cannot exist in separate, isolated bubbles.
It has to be coordinated.
It has to be. For patients who conceived via medical intervention, like IVF or IUI, there's a very deliberate transitional phase. You aren't just instantly dropped off at an OB/GYN's office the morning after you get a positive test.
Thank goodness for that.
Right. Your fertility clinic is going to continue monitoring you very closely.
They are looking for specific biological markers, right? I mean, it isn't just about taking a blood test to say, yes, you're pregnant. They are tracking the rate of change.
Yes, exactly. They will be checking your beta-HCG levels.
And for those navigating this for the first time, beta-HCG is the specific hormone your embryo produces right after it implants. In these early weeks, clinicians don't just want a positive number.
No, they want to see that number doubling, usually approximately every 48 to 72 hours.
Wow, every 2 to 3 days.
Right. That doubling time is the clinical confirmation that the pregnancy is actively progressing. They are also tracking your progesterone levels and bringing you in for early, specialized ultrasounds before they ever hand the baton over to an obstetric provider.
But this level of care shouldn't just be reserved for IVF patients?
Not at all. If you conceived without recent medical treatment, but you still have a complicated history, say recurrent miscarriage, endometriosis, or previous ectopic pregnancy, the source emphasizes that you need to actively ask your provider what early monitoring is appropriate for your specific circumstances.
It really requires you to be the project manager of your own biology?
That is exactly what it is.
You are the central hub holding all the files, ensuring that every single member of your medical team knows everything. Your reproductive endocrinologist needs to know about the supplements your acupuncturist recommended, and, well, your OB needs to know the exact dosage of the progesterone your fertility clinic prescribed.
Every piece of the puzzle matters.
But managing all this brings up a massive psychological challenge for anyone who has struggled to conceive. If you've spent 3 years tracking every basal body temperature and hormone fluctuation, your brain is just hardwired for hypervigilance.
It's a trauma response, honestly.
Yeah, exactly. It is so tempting to symptom spot. If a listener feels cramping or spotting, their brain immediately screams, "Change the medication." Why is that a bad idea?
I mean, the urge to react to every physical twinge is completely understandable, but it is clinically dangerous. The symptoms of early pregnancy are incredibly terrible narrators of the actual biological story taking place inside the uterus.
That is such a good way to phrase it. Terrible narrators.
Right. Spotting, cramping, severe breast tenderness, or even a sudden loss of nausea can be absolutely terrifying to experience, especially after a prior loss. but they do not provide a complete or accurate clinical picture.
Let's break down the mechanics of why those symptoms are such unreliable witnesses. Take cramping, for example. We associate pelvic cramping with our period, which signals the end of a cycle.
Right. Our brains are trained to panic at that feeling.
But in early pregnancy, cramping is often caused by the very hormones sustaining the embryo, isn't it?
Exactly the case. Let's look at progesterone, which is essential for maintaining a pregnancy. Progesterone's primary job is to relax smooth muscle tissue.
Okay, so it relaxes the uterus.
Exactly. It does this to keep the uterus quiet and prevent it from contracting and expelling the embryo. But, and this is the kicker, your digestive tract is also made of smooth muscle.
Oh, wow. I never thought about that.
Yeah, so the high levels of progesterone cause your entire digestive system to slow down. That leads to constipation, bloating, and gas pain that feels functionally identical to menstrual cramping.
Which is the physiological reason why you never stop, start, or change fertility medications based on symptoms alone.
Never.
If you feel cramping and assume you are losing the pregnancy, and then you decide on your own to stop taking your prescribed progesterone support, you might actually be cutting off the very hormone that is keeping the embryo implanted.
You are flying completely blind if you make those clinical calls yourself. Having a coordinated care plan is your ultimate safety net.
It gives you a space for those questions.
Exactly. It creates a defined space for those logistical, sometimes silly-feeling questions like, when exactly is the ultrasound? Who is on call if I bleed on a Saturday night? Knowing the mechanics of your care reduces a massive amount of avoidable uncertainty.
So establishing that medical safety net takes care of the clinical side. But you don't live in a clinic.
Right, you live in your body.
You live in your house, staring into your fridge at 2 p.m., feeling totally nauseous, trying to figure out how to navigate the rest of the day. Let's talk about the everyday reality of nourishing this pregnancy.
It is a daily battle for a lot of people.
Here's where it gets really interesting, because I think trying to maintain perfect pregnancy nutrition in the first trimester is a total trap. Think of early pregnancy nutrition less like building a Pinterest-perfect architectural masterpiece and more like laying sandbags during a flood.
That is the perfect analogy, laying sandbags.
It doesn't have to be pretty, it just has to be functional.
The biological hurricane of early pregnancy hormones makes rigid, idealized meal plans completely unrealistic. The Berkeley Center Guide is incredibly clear on this. Nutrition right now is about consistency, not perfection.
Because you are dealing with nausea, intense food aversions, bone-deep fatigue, and a completely shifting metabolic rate.
If the very thought of steamed kale and wild-caught salmon makes you gag, you do not need to force it down.
Thank you. I think people need to hear that. The focus needs to be on practical survival, hydration, blood sugar stability, and getting the specific micronutrients needed for early fetal development.
Yes, you keep taking the prenatal vitamin recommended by your physician, paying particular attention to folate.
And we should explain why folate is the non-negotiable one here. Long before you even see a heartbeat on an ultrasound, the embryo is forming the neural tube, which eventually becomes the brain and the spinal cord.
It's the absolute foundation.
Right. Folate acts like the cellular zipper that helps that tube close completely and properly.
Without adequate folate, that cellular zipper can fail, leading to severe complications. Alongside your prenatal vitamin, the guide heavily emphasizes protein.
Protein for nausea, right.
Exactly. Incorporating protein at meals and snacks can actually be a highly effective intervention for nausea.
Because it prevents the blood sugar crash. When your blood sugar plummets, it triggers the nausea center in the brain. Stabilizing it with a steady drip of protein takes the edge off.
It creates an even metabolic baseline. But again, practical is the key word. If a piece of plain white toast is the only sandbag you can manage to lay down today, that is enough.
Just get something in your system.
If cold foods, bland carbohydrates, or eating tiny meals 8 times a day works better for you than a normal 3-meal routine, you just do that. Feed your body what it will accept.
I think that gives people so much permission to just breathe. But there is a firm clinical boundary here, right?
Yes, there is. The source points out that if vomiting becomes persistent-like, to the point where you cannot keep fluids down for 12 to 24 hours, you have to contact your provider promptly.
Do not just tough it out at home.
Absolutely not. Dehydration in early pregnancy can lead to severe electrolyte imbalances and requires medical management.
And that need for clinical guidance becomes even more crucial when we move away from food and look at supplements and herbal remedies.
This raises an important question about how we fundamentally view the word natural in the wellness space.
Right. I want to challenge a really common assumption here. We naturally assume that if a supplement or herb help us get pregnant, it'll help keep us pregnant. Plus, if it's labeled natural, it's safe, right? Why is that such a dangerous assumption?
The danger lies in ignoring the biological pivot that happens at conception. The body's physiological requirements change the very second, literally the second, an embryo implants.
So what worked yesterday might not work today.
Exactly. Prior to conception, you might have been taking herbs designed to optimize egg quality, stimulate ovulation, or heavily increase blood flow to the uterus to thicken the endometrial lining.
But once you are pregnant, heavily stimulating blood flow to the uterus is the exact opposite of what you want.
Precisely. A newly implanted embryo requires a stable, quiet uterine environment.
So those old herbs could be harmful.
An herbal formula that was perfectly appropriate and even highly effective for conception might stimulate the uterus in a way that induces contractions or bleeding after conception. More is not automatically better.
Early pregnancy is a time for a complete reassessment of your medicine cabinet, not continuation by default. You need a qualified reproductive herbalist, someone who understands both Eastern medicine and Western fertility protocols, to review every single formula in the context of your current pregnancy.
Just because an herb is natural does not mean it lacks an active physiological mechanism of action.
Which is why you must never take supplement advice from an influencer's social media post over individualized professional guidance. Your specific medical history dictates what is safe.
It really does.
So if herbs are tricky and supplements need strict monitoring from the care team, what complementary therapies can you safely use to support your changing body? This brings us to integrative care, specifically acupuncture.
Acupuncture is a phenomenal tool here.
But wait, isn't acupuncture just acupuncture? If a listener just goes to the standard wellness clinic down the street to relax, is that enough?
Oh, definitely not. It absolutely runs the same risks as those herbal formulas we just talked about, which is why general acupuncture is not recommended here.
So it has to be specialized.
According to the Berkeley Center for Reproductive Wellness, acupuncture can be a fantastic natural extension of your fertility plan, provided it is executed by a specialist. An acupuncturist treating early pregnancy must have substantial specific fertility experience.
Because the points they choose have to change entirely, right?
They do. In traditional Chinese medicine, the goal shifts from invigorating the reproductive system to lifting and holding the pregnancy.
Lifting and holding. I love that phrasing.
In Western physiological terms, specialized acupuncture is used to modulate the sympathetic nervous system, bringing you out of that fight-or-flight stress response, and to improve localized, safe blood flow without overstimulating the uterine muscle.
So it's very targeted.
Yes. At their center in New York City, the primary goal of early pregnancy acupuncture is preventing miscarriage.
And it goes beyond just the mechanics of the uterus, right? They tailor it to address the intense nausea, the sleep disruption, and the pelvic discomfort.
But we must be incredibly clear. Acupuncture is complementary care. It is a powerful tool to modulate symptoms and support the nervous system, but it never, under any circumstances, replaces urgent medical assessments or prenatal visits.
Right. It works alongside your medical team's protocols.
Exactly.
I'm really glad we emphasized that, because managing the physical body through coordinated medical care, practical eating, and safe complementary therapies like specialized acupuncture is only half the battle.
It really is.
Those physical symptoms directly trigger an enormous emotional toll. Let's pivot and look at the mind-body reality of early pregnancy, especially for the listener who has a history of medical trauma.
This is perhaps the most validating section of the guide. It actively acknowledges the emotional reality that so many patients suffer through in silence.
Society tells you to just be grateful you're finally pregnant, but this source says it's totally normal to feel grief, fear, or detachment. That feels incredibly validating, but how do we manage that fear when every symptom feels like a threat?
What's fascinating here is how the source frames this dual reality. Expecting to feel calm or purely joyful after a positive test is often a complete myth.
You can't just turn off a threat detection system that has been running high for years just because a test came back positive.
You really can't. If you have a history of prior loss, early pregnancy brings grief right alongside the hope. Those two emotions sit in the exact same space, and that is a normal psychological response.
Let's ground this in the physical symptoms for a second so we know what we're reacting to. The guide states that normal early pregnancy symptoms, things that do not indicate a loss, include mild cramping, light spotting, nausea, fatigue, and breast tenderness.
But then there are the red flags. the biological alarm bells that demand prompt medical attention.
Right, things like heavy or worsening vaginal bleeding or severe one-sided pelvic pain. But the one that always surprises people is shoulder pain.
Yes, that is a big one.
If you've never heard of this, it sounds bizarre. Why would your shoulder hurt if you were having a pregnancy complication?
It is a fascinating and critical piece of human anatomy.
It has to do with the phrenic nerve, doesn't it?
It does.
If you have an ectopic pregnancy where the embryo implants outside the uterus, usually in a fallopian tube, and it begins to rupture, it causes internal bleeding in the abdomen.
Which is a life-threatening emergency.
Exactly. That pooling blood irritates the diaphragm.
Yeah.
And the nerve that supplies the diaphragm is the phrenic nerve. Its pathway runs all the way up through your chest and ends at your shoulder.
It's all connected.
So a sharp, unexplainable pain in your shoulder tip is actually your body's alarm bell for a massive pelvic emergency.
That referred pain is a textbook red flag. That, alongside fainting, severe dizziness, fever, or that persistent vomiting we mentioned earlier. If you experience any of those, you bypass the internet and contact your physician immediately.
But realistically, going back to the emotional side, how do we manage the fear when every normal symptom, like a mild cramp from progesterone, feels like an existential threat?
The Berkeley Center reframes this beautifully. The goal is not to eliminate uncertainty.
Because eliminating uncertainty in the first trimester is biologically impossible?
Exactly. The goal, rather, is to have a robust care structure in place so that you do not have to carry that uncertainty alone.
Offload the vigilance to your medical team.
Precisely. When you feel a symptom that feels off, you have a system for addressing it. The guide is very firm on this. Seeking clarity is never overreacting.
I love that. Seeking clarity is never overreacting.
If something feels different from what you were told to expect, call your team. You aren't being annoying. You are utilizing the very care silos we broke down at the beginning of the discussion.
So what does this all mean? As we wrap up this deep dive, let's distill the core advice for you, the listener, during these first vital weeks. Simplify your life right now.
Keep it simple.
Keep your appointments, your ultrasound dates, and your medication instructions in one central place. Eat whatever you can actually tolerate to lay down those sandbags, even if it's saltines at 2 a.m.
Give yourself explicit permission to decline obligations, parties, or extra work projects that just add unnecessary pressure to your nervous system.
And practically speaking, when you do transition from your fertility clinic to your OB, demand a clear handoff plan. Ask for your records.
Make sure every clinician understands your unique medical history so you don't fall through the cracks during the transition.
Ultimately, it means that good early pregnancy support is highly responsive to you, the individual. It is not a rigid formula you have to perfectly adhere to.
If we connect this to the bigger picture, the most helpful next step you can take is often the least dramatic one.
It isn't buying a new miracle supplement.
No. Or starting a drastic anti-inflammatory diet. It is simply staying connected to qualified care. It is having the courage to ask the specific, terrifying question that is keeping you awake at night and allowing your pregnancy plan to be guided by clinical facts rather than generalized internet anxiety.
You really have to let go of someone else's pregnancy story. Which leads me to a final thought I want to leave you with, something to just chew on after we sign off.
This is an important one.
Think about the anxiety you might be feeling right now. How much of your early pregnancy anxiety is actually rooted in physical signals from your own body? And how much of it is just the ghost of an internet forum or a tragic social media post about someone else's loss that you doom scrolled through in the middle of the night?
It's so easy to absorb other people's trauma.
It is. What if the absolute most radical, most effective act of self-care you can do for your pregnancy right now isn't buying something new or analyzing another symptom? What if it is simply logging off, tuning out the digital noise, and placing your trust in the expert team you've built to support you?
Focus on your own marathon.
Exactly. To run this new marathon, you have to look at the road directly in front of you, not the screen in your hand. If you want to explore more about the specialized integrative approach to early pregnancy support, you can find a wealth of information at www.berkeleycenter.com. Thanks for joining us on this deep dive. Take care of yourself and trust your team.